afternoon. Welcome to our show. I'm your host, Melissa Ridgen. We've got a lot going on for you today. Silver linings in this pandemic, including a food distribution group that's making sure food supplies disrupted by the pandemic are getting to where they're needed. They're also doing innovative work that we're going to share their successes with you. We will get some tips as to how you can get a food network going too. And it's important to remember that food security will be an issue long after this crisis because much of the food supply chain was shut down. So experts say to expect a delayed ripple effect, which we will discuss. Then we'll get an update from our relatives in the Navajo Nation, which has been ravaged by COVID-19. We're lucky that we found some people who can take time to join us. It hit hard and fast, but the federal government's response was slow. That Doctors Without Borders, an international aid agency, has sent teams in to help. We talked to a Navajo University professor and a medicine man about the situation there. There are 5,300 cases of COVID-19 in the federally recognized tribe alone. And then we are switching gears to the Native Women's Association of Canada. They're sounding the alarm about the safety of women and children and two-spirits during this lockdown. A lot of the safety nets that were available to them have been rolled up and put away. We'll find out what is needed to help. And we will meet three bright young First Nations journalists with Indigenous who are bringing us news from a portion of BC that until now has been an Indigenous news desert. And we'll also have an update on a beater who found herself in high demand after Whoopi Goldberg wore one of her missing and murdered Indigenous women and girls medallions on the popular talk show The View. Orders went through the roof, and now some customers say that they were ripped off. The beater says that's not the case. She's just overwhelmed with orders. Of course, it's a call-in show. We always love to hear what you have to say. If you've got questions or you want to add to the conversation, you can give us a call toll-free at 1-877-647-2786. You can also tweet us at APTN InFocus, and you can comment, of course, if you're watching on our APTN News live Facebook feed right now. Well, let's get started with my first guest. He is the Executive Director of the Regional Food Distribution Association in Thunder Bay. You may have heard that many producers have gluts of food, from milk to potatoes, any number of foodstuffs, because this COVID pandemic has had such an impact on restaurants. So what do these stockpiles do, or what do we do so these stockpiles don't go to waste? Well, my first guest is part of an innovative program that gets massive shipments of food to communities in need, including 20 First Nations in Northern Ontario. Volker Krom is the Executive Director of the Regional Food Distribution Association of Thunder Bay. So, Volker, tell our audience who's watching from across Canada, so might not know about your organization in Thunder Bay, but tell us what your organization does.
Well, we represent Feed Ontario and Food Banks Canada here in Thunder Bay, and our mandate is to serve all of Northwestern Ontario. So we're the food banks for food banks, and we take care of some of the emergency needs of the established food banks. But over the last couple of years, we have been trying to service the remote communities, the eroded First Nation communities that certainly don't have access to food like everyone else does. So that's been a big job.
I would imagine. You've got, I think you said 20 First Nations spread out through Northwestern Ontario. Getting pallets and pallets of food shipped up to them does not sound like an easy task. How does it work?
Well, that's actually, yesterday was kind of exciting because we had all of the food, all the pallets lined up outside in the sunshine, and had our volunteers were putting it together. It's an assembly process and shipping it out. So right now we have pallets going out to 20 different communities along the Trans-Canada Highway, and then some of them are remote. So we're trying to help our donors and our First Nation partners get over this COVID emergency. So it's a busy place. And once that is out, then we start on the next wave of communities. So we'll probably be servicing another 35 communities over the next couple of weeks as we move into the other remote communities.
Tell us how this pandemic has changed what your organization does.
Well, it certainly has brought to bear the inequities that a lot of these communities are dealing with. Mm-hmm. So the access to food just isn't there. What we're finding is that trying to buy bulk food, trying to manage the donations that are coming from all across Canada is a job that we never anticipated. So whereas we would be able to manage a throughput in our warehouse of 9,000 to 25,000 square feet. Now we have to bring in sea containers, and we're renting commercial spaces, because quite frankly, to move that kind of volume and service 50 plus communities is something we never anticipated. And so working with the communities has been an enlightenment. So we're finding new limits to our infrastructure and our capacity. So we're excited about being able to help, but it certainly has not been an easy journey.
You talked about response to the crisis. So, this is the crisis hits. It's apparent that already food insecure places are going to be hit even worse. But you said that there is a need to pair food surpluses with communities in need during the recovery process too. So people need to keep in mind that after this crisis portion of the pandemic is over, there's going to be a recovery process where food is also going to be an issue. Can you explain all of that to our audience? Because it was nothing I'd heard until we had our conversation the other day.
Well, quite frankly, and I agree, I'd never anticipated the amount of food that is available here in Canada, and the generosity that's coming from donors, stores, restaurants, farmers, meat processors. We're getting inundated with calls for potatoes and milk and frozen foods. The processors right across Canada have been offering food to us. And so, yes, at the beginning, there was a big surge to try to deal with the emergency portion. But now as things move on, there's still a great amount of, especially perishable foods in the system that we're going to have to try to manage, move out to these First Nation communities, Indigenous communities right across Canada, and find a home for them. And this is not easy, given in the past there's never been the infrastructure, the logistics established for this kind of volume of donated food.
So explain to us how your organization works, like finds these people who have these surpluses. Potato growers, I know they've been in the news a lot because last year's potatoes are sitting there not used because the pandemic shut down restaurants, so nobody's cooking potatoes or making French fries. There's going to be people. There's people who grow things. They're going to have these supply kind of gluts too. How do you find out about them? How does a person outside of your organization, outside of your region, find out? Okay, where is there a surplus of food, and how do I get that to a First Nations community or any community that's in need? If you can kind of give us some advice on how people elsewhere in Canada can do what you've got going on there.
Quite frankly, it's all about networking. Very important. We are very fortunate to have Food Banks Canada has taken a leadership role right across Canada. And so they have been reaching out to producers and donors, processors right across the country. And they connect with Food Banks Canada, as well as the provincial associations. Every province has an association.
Okay.
We belong to Feed Ontario. Manitoba is very fortunate to have the Winnipeg Harvest. They manage the entire province, so that the where you would go and produce. The donors and the producers are going to them, asking that question. In our work over the last couple of years, we have been working on building those relationships with individual communities. Mm-hmm. That's been our task. So we marry the individual communities with the corporate donors, the provincial donors, and it's interesting how quickly the word of mouth goes right across the country. Mm-hmm. I get these phone calls saying, we heard you're the guy. And so that
I heard that about you too. Why do you think I phoned you?
Well, it's working very well. Yeah. And so with my association with Food Banks Canada, I have contacts in Winnipeg. So Karen Hughes-Taylor in Winnipeg, she's great because she has her own network, and so we're starting to marry them. So in Montreal, there's a gentleman there with the Quebec Food Banks. Gael is sort of my contact, and they're starting. I put the challenge out to all of them, saying, all right, there are communities that don't have fair access, or it's very expensive, or getting food to them is a challenge beyond your imagination. So,
Yeah.
and these leaders in our industry are picking up the chalice, and Ottawa has been really great, and some of the Prairie Province now are also stepping up. So networking is the key here.
Yeah.
And so belonging to that association or the organization, sometimes there are these little organizations around food security, but we're looking at a much bigger scale. COVID has been a global challenge, and here it is much more than a Canadian challenge as well. But I think we're reaching out to leaders. We've reached out to all levels of government, but I think the building block has been working with the individual chiefs and councils. The leadership in each community has been instrumental in making that happen. So you've got to reach out.
So if somebody in a First Nations community in the middle of nowhere up north in Alberta is watching this right now and says, we are food insecure, we need something like this, you would tell them to contact either Food Banks Canada or who, their provincial food bank umbrella group.
Yes,
Okay.
Normally all of them have a provincial association that works with food banks, very closely with Food Banks Canada, and the team will help you connect with the right organization. And I do the same thing because I've got food coming from Edmonton and I from Winnipeg, and so without that network, it doesn't function very well.
Yeah. What's next for your group?
Well, we're going to be looking at having conversations with some of the communities. Some of them need to have a recovery plan because, quite frankly, moving forward, so whether that be food banks or gardening or buying groups, there are a lot of options that have been discussed many times. We're a charity. We don't have the resources, but we certainly do have the ear and the eye of the National Provincial Association where we can step in and help. And we can tap into expertise that will help them with their food sovereignty plans, buying groups, because quite frankly, after we develop the relationships, there's the infrastructure, there's training. Every community has to have a champion, so that's our biggest challenge. My champions, my heroes of all time are the administrative executives and assistants in every community, those women and men that sit by the phone and make things happen. You think it's the chiefs? No. It's the people who behind the scenes that make it all happen.
Always the case. Volker, thank you so much for taking the time to share with us what you're doing and how people can get involved to fill a need where they are too. Thank you so much.
My pleasure.
COVID-19 hit hard and fast on the Navajo Nation, which occupies just shy of 18,000 acres in northeastern Arizona, southeastern Utah, and northwestern New Mexico in the United States. Let's take a look at some of the numbers. 356,890 people make up the tribe, which has more than 3,000 cases of the virus. More than 100 people have passed on. Joining us now from the Navajo Nation is Michael Lerma. He's a school dean at Diné College. His background is in American Indian Studies and International Relations. And Avery Denny, he's a member of the Diné Medicine Man's Association, and he's a teacher at Diné College. He's spent 3 decades teaching herbology, holistic healing, Diné cultural, oral history, and philosophy. And they join us now from Navajo Nation. Thank you, gentlemen. So I want to say, as the COVID pandemic began to spread across the world, I'd like to hear from you both. What were you thinking as it pertains to your nation?
It got scary because the elders, the people that exhibit a lot of the conditions that make to losing your life, they carry the knowledge, they carry the ceremonies, they carry the language. And so that was something that we took very seriously around here at Diné College.
Your nation is per capita one of the hardest hit in the United States. How did this virus enter the community and how did it spread so quickly?
You want to take it or you want me?
Go ahead.
The first report that we heard about was in a very small community called Chilchimbato. I'm not sure how it got there, but when that individual became ill, they went over to the hospital in Kayenta, and that's when we started to hear that it was coming within the Sacred Mountains.
What was the community's medical response to this initially, and what was the panic, I guess? Because, of course, once it hits your community, the panic is the next step, right? How did the medical facilities there cope initially?
I would say that we didn't necessarily panic. I think we just really worked hard to understand that, okay, we're going to have to take on the 14-day self-isolation protocol in order to protect people that would be more susceptible to COVID-19. I can't speak for all the communities, but I can speak for this community in the Saline area where Diné College is located.
What's been the federal government's response to the crisis there?
As far as I know, they have made overtures to Diné College in order to provide funding and increased healthcare coverage. Sometimes that makes it through. Sometimes there's bureaucratic issues that get in the way of it. And so a lot of it has come from grassroots organizations, mutual aid. It's an expression of a term that we utilize in Navajo Nation called ke, which is based on kinship. And so we're just taking care of one another because we all are related. We're all five-finger Earth surface people. And so we're making sure that, the people that need these masks, they have them, and some of them were 3D printed, some of them were sewn up, mailed out, what have you. So that's really been the way that we've utilized our relationship to make sure that everybody is healthy and well fed and they have water, things like that.
Avery, can you give us an idea what life is like in the nation now, what rules exist, and how it's affecting the spirit of its members there?
Well, let me just say, I come from a rural area, and where I live, my closest neighbor is about 1 mile, and a lot of these places are like that. And the places that are very hit hard are in the community areas, like where schools and modern homes located in a school. There's a supermarket there and chapter, a population of a group of people with, that's the hardest. Out in the rural area in the traditional setting, it seems like everything's all normal. All these cases that you hear about are in those small towns, but out in the rural areas, the people are scattered far away. And but one of the things that really affected is we can't do our traditional ceremonies, and our spiritual leaders, they went out and said, don't gather, calm down, follow the rules, listen, and don't do any ceremonies, because it's a place where people all get together, almost like having a congregation in a church or revival. People can get affected real quickly like that. So we're ordered to avoid all of that. So we're waiting to start off again, maybe in the later part of June or even in August.
So I wanted to ask you about that too. There is a lot, and this is certainly the case north of the border too here, lots to talk about the role of our traditional medicines and ceremony during this. Avery, what's the conversation there? What are you is there a conversation about traditional medicines, their use, their purpose, their application during this? Ceremonies, is there an encouragement of people to do ceremonies differently, do them at home by yourself or with your family who you're isolating with? What's going on there in that regard?
In the traditional medicine, the traditional people, they are instructed to do ceremonies when problems it becomes in existence. Like in this case, the virus is a unknown sickness, disease that came to Indigenous people. if it was in the traditional setting, we would already had ceremonies done to protect ourselves and all of that. So we can't even do that because a lot of the things that are going in the Navajo reservation is that politics, Christianity, kind of like overshadowed, and they kind of like took over. And we were instructed just to hold off on our ceremony. We can't do ceremonies.
Is there a greater demand for medicines?
But we can do our own prayers in our own homes. That we can do that.
Are people contacting you for medicines? Is there, because I know here in a lot of our communities, people are hitting up our traditional healers looking for things to boost our immunity. Is that the case there?
Yes, I get calls and I get emails to go drive like 2 hours to meet with people and to make an appointment like that, and I can't even go out to other areas, so I'm so isolated, and I try to stay home. So my children tells me, don't go over there, stay home and protect yourself.
Back to you. What are the, Michael, sorry. I've heard that there's Doctors Without Borders have sent teams to your nation. Can you give us a little bit about how that all came to be and what they're there for?
So typically, Doctors Without Borders is an organization that reaches out to international regions, and it's interesting because now they're remarking about it, saying that it's a rare exception that they stay within the colonial borders. So they have reached out, they have been on site, trying to ensure that the pandemic doesn't get completely out of hand, and just treating people where they can. We're already, as an Indigenous nation, we already lack healthcare. As you know, north of the border, the entire United States lacks universal healthcare.
Yeah.
And Indigenous nations and the Navajo Nation, they'll get the worst of the worst in some ways. And that isn't to disparage the people that come to the Navajo Nation to come to work. I know their hearts are in the right place, but we're talking about funding, we're talking about infrastructure, we're talking about access to very basic tools such as a test for COVID-19. Those kinds of instruments are lacking.
Well, I thank you both for taking the time to join us and share with us what's going on with our relatives down in the Navajo Nation. Thank you both. Stay healthy.
Same to you. Agone.
Merci. We have to take a break, but when we come back, these are particularly dangerous times for women and children and Two-Spirits. What should be done to help? We'll find out with the Native Women's Association when we come back. Oh, and later on the show, an update on a Manitoba beater whose work was worn by Whoopi Goldberg of The View late last year.
Join our conversation now. Call in toll-free at 1-877-647-2786. Like us on Facebook on our APTN News page. Follow or tweet us at APTN InFocus. And send your thoughts to infocus@aptn.ca.
Welcome back. We want to give you an update to a story that we told you about last December. Saugeen, Manitoba beater Mish Daniels was floored to see a missing and murdered Indigenous women and girls medallion that she beaded on the popular American talk show The View, worn by host Whoopi Goldberg. Take a look.
People have been asking me about the necklace I'm wearing. It represents, thank you, all Indigenous women who went missing on the Highway of Tears. All the women who've gone missing in this country as well. One of the things that we always talk about is we say, well, you know, the press doesn't really pay attention when little black girls go missing or when, you know, little brown girls go missing. Well, if you think they don't pay attention then,
Yeah.
be Native American. The Native American and Indigenous people find themselves out looking for their people who have gone missing. They do this themselves. So this is representative. It's a huge number. And there's an extraordinary book called The Highway of Tears, which I would recommend to you, because I think women need to come together and say, none of us should be gone missing. There has to be a way for all of us to do this better and look out for each other. It's not, you know, it can't be white women saying, well, we don't want to do it. It can't be black women saying, well, nobody's looking for us. It has to be all women saying, damn it, none of us should be going missing at all. None of us should be missing at all. You know? So this is my plea. Find out more about this, because if they can take one of us, they can take any of us.
So that right there resulted in an influx of orders for these missing, murdered Indigenous women and girls medallions. And that good news story has taken a turn when it came out recently in a CBC News story that several customers say that they paid for medallions that they've never received. Jennifer Lee is one of the unhappy customers who said that she paid $150 for a medallion back in December, plus $20 for shipping and tracking. It's now May, and she said that she still hasn't received the beadwork and was told that it must have been lost in the mail. And she says that she's now blocked from communicating with the beater. She had planned to gift that medallion to a friend who lost a sister on the Robert Picton farm, so feels extra hurt by the situation. A Facebook page has blown up with others who say that they feel ripped off too. So we reached out to Mish Daniels, the beater involved here, about these allegations. Here's what she had to say. I got help now with the orders and finishing and completing them all now. Hopefully this can get sorted out to everyone's satisfaction. So let's switch gears now. With this pandemic, many crisis services that help the vulnerable or at risk are also now in lockdown. The Native Women's Association of Canada says First Nations, Inuit and Métis women are at increased risk of violence during these times. And they criticize the federal government for failing to implement the nearly year-old report of the inquiry into missing and murdered Indigenous women and girls and Two-Spirit people. Joining me now to discuss is NWAC President Lorraine Whitman from Halifax.
Good afternoon. Thank
Hi,
you.
Lorraine, thanks so much for joining us. So let's start off with you explaining to us why this pandemic puts our women, girls, and Two-Spirits at risk more so than in other times.
Okay, first of all, we are a large marginalized, vulnerable group of people, to start with, going back to colonialism and what have you. But this pandemic has given an extra crisis to the pandemic in that the violence, domestic violence has increased. And mainly with this pandemic is self-isolating and social distancing. It's making it more difficult for women to be able to reach out to resources and services being able to. As we know, our Prime Minister and the health says to self-isolate, social distancing, and, you know, stay at home. It's a safe place. You know, in a perfect world, it is a safe place, but for women and children and elders who are in an area of an abusive situation, the abuser, the perpetrator, is still in that living quarters, which makes it even that much more difficult. And
there's not the escape of school or work necessarily, right? Like, that gets you out of there. Sometimes you're honestly trapped like a jail with your abuser in times like this.
Exactly. And, you know, when we look at the, you know, domestic violence with the women, the elders, our Two-Spirit, we also have to be recognizant of our young children that are in the situation because of not being in school. They're being in this home as well, seeing the abuse being done. So you can appreciate the mental health as well as these young children that are in the situations.
If Ottawa had acted on the MMIWG report, making the changes that were suggested, would the situation be as dire right now for women, girls, and Two-Spirits?
In my mind, the dollars would have helped as being proactive, but because of the crisis situation, it's going to take a long time to be able to look at the root of, you know, of the situation with colonialism. But if there were fundings that were there, it would certainly be able to be that positive movement that we needed to start and to start implementing. Mm-hmm. I know at NWAC we did do an assessment. We also have a survey online, which will be finished today. And we do have 4 in-house elders that are support workers and taking calls on a 1-800 number. And they've noticed the increase in violence from the women that they've received, as well as even others with suicide. So these are really high numbers because it was 64% with violence with women, 64 with child abuse, and 64 with elder abuse.
Last week, you had mentioned that you had a virtual meeting with Foreign Affairs Minister Francois-Philippe Champagne and International Development Minister Karina Gould. There is an urgent need to implement a national plan for meeting the 231 calls for justice issued by the inquiry. What was the outcome of that meeting?
It was a very productive meeting in my mind, in that with NWAC, we are working internationally with the Alliance Women in the Americas,
right,
in which they're finding it devastating in that their country doesn't have the resources that we have here, in saying that their small businesses are owned by the women, and they're bringing the income in, helping with the schooling, the education, and their basic needs. And if their businesses close up, then there is no dollars. They don't have social assistance like we have here in Canada to be able to help them. So that's devastating in their area. They don't have the water as well, nor do they have the extra income that's needed in the state that they're in.
Has there been any progress by Ottawa that NWAC is pleased with since that report came out?
You're speaking of the National Inquiry Report?
Sorry, yes.
Okay. We haven't heard any more news on that. We're hoping, and we do have faith in the government that they will include us. But I do feel that, in the funding that has gone out, I do feel that NWAC could have been involved in that the GPA, making sure that the gender analysis had been taken so that it meets the women's needs as well. And I'm not sure that that funding component had been taken into account.
Lorraine, what could be done immediately by Ottawa that would help at-risk, vulnerable women, girls, and Two-Spirit people?
Right now, I feel that if the government is truly there, that, we had put in proposals for doing our mask, and before we had also put in proposals for the commemoration fund. And the Native Women Association, we were at the forefront even with Sisters in Spirit, as well as the forefront with the inquiry. And when we had applied for the proposal for commemoration fund, we were refused. And that's devastating in itself. And I believe that we should be looked at and recognized, as well as our accord that we had signed February of 2019, that should be, the agreement should be looked at, that we are at the same level as our other Indigenous organizations. We should be at the table. And that would make a difference because then we would have our input at the tables with the government.
Have you guys done a report card kind of grading the government on how they've done with regards to the calls to action, or not calls to action, the 231 recommendations in the final report? Have you guys done sort of a step-by-step through those and graded the governments?
No, we haven't. But
want to grade them right now?
Well, right now I haven't seen any movement with it at all.
So they get an F.
I know on our part of NWAC, we've been doing the best that we can because the families, they have already testified. They've given their stories, their testimonies. The commissioners wrote it. And it did say that it was a cumulative, of genocide. And we as NWAC, we represent our grassroots people. and they want to see action. They're tired of hearing the talk but not walking the walk. So I think and I really do have faith that if the government works together with us, there will be progress, but we need to see action from the government starting to realistically move with this, and that's what we're trying to do, to see what their action plan is. We've already started, and we would like to hear what they have to say.
Well, in the meantime, it sounds like an F to me, is what you're saying.
Well, yes, I would. I would say F will say I hope there's faith there in the government to be able to look, at the national action plan. And we're willing to be able to work, with partners the best we can, for the women, the girls, the two-spirited, and our gender-diverse people.
Well, we appreciate the work that you guys do at NWAC, and it's always nice to talk to you, Lorraine. Thanks for carving out time from your day to have this important conversation with us.
Thank you very much for having me on, and I just hope that things improve and take care of yourself with this COVID crisis. And I just to conclude, I leave you with this thought. As we begin to reflect on COVID, we can look at it as a genuine example of how much change is possible in a short amount of time when enough lives are on the line. And when I look at our MMIWG, murdered, missing Indigenous women and two-spirited, we have lost many of lives on the line. And this is well over 50 years ago, and there has not been much help in assisting us with our families and our sisters that have passed on.
I appreciate those wise words. Thank you so much, Lorraine. Stay healthy.
Thank you. You too.
Thanks.
Okay.
Well, we need to take a break. We will meet the new Indigenous reporters who will be covering Indigenous news in the Okanagan, a massive area that had previously been a news desert. We're going to meet them after the break, so you stay with us. Welcome back. Last week, a brand new news platform was launched. Indigenews is a digital platform for local news serving First Nations, Inuit, and Métis communities in BC's Okanagan region and soon Vancouver Island. Both areas have been unserved to this point. This joint venture is a partnership between The Discourse and APTN and aims to address the long history of Canadian media poorly representing and perpetuating stereotypes about Indigenous people and communities. So the goal of Indigenews, according to a press release issued at its launch, is to provide journalism that is driven by local communities' needs. And second, to develop a new business model for local digital news that contributes to the long-term sustainability of independent Indigenous news. So joining us now to talk about the new news service are three Indigenous reporters who will be bringing you these stories. Shahela Leonard is reporting from the Okanagan for The Discourse as part of the local journalism initiative. She's a journalist and documentary film producer from the Assiniboine-Winnawa. Is that right?
Assiniboine-Winnawa.
That Assiniboine-Winnawa Nation near Grand Cache, Alberta. We also have Athena Bono. She is an education reporter for The Discourse as part of the local journalism initiative. She is Silk Northern Cree, a journalist who was born and raised on unceded territory of the Penticton Indian Reserve, where she currently lives. And Kelsey Kilawana. She is reporting from the Okanagan for The Discourse as part of the local journalism initiative. She's Silk, a journalist, photographer, who's born and raised in the Okanagan Indian Band. Thank you all for joining us. It's so nice to see your faces, and I'm so excited that you guys are going to be covering this news. It's always bothered me as a journalist that's such a giant chunk of this country that's not served. APTN doesn't have anybody there. There's local news, but as you're well aware, as journalists, local mainstream media, if you will, doesn't necessarily cover our issues overly well. So I'm curious to hear from, we'll start with you, Athena. What drew you to want to join Indigenews?
What drew me to join Indigenous was just to tell the untold stories that go on in Indigenous communities. There's a lot of things and perspectives that are very mixed, and I just wanted to bring the truth.
So I would ask you the same question. What drew you to want to join Indigenous? It's a brand new entity, so you don't really know what you're joining. What drew you?
Again, it was just community-based, community-driven journalism. So for me, it's super important to be telling stories that are coming from within the community, and that's when I, first heard the discourse. And APTN, we're starting this partnership. I really wanted to be a part of it because it's something that I believe in.
And do we have? I'm not sure if we were having some technical difficulties getting Kelsey. Do we have Kelsey?
Oh. I'm here.
Kelsey's there. Kelsey, welcome. I just can't see you.
Oh, no worries.
So, what was it that drew you to Indigenous when you saw that this was going to launch? What made you want to be a part?
Well, I've done a lot of work around the reclaiming of identity. So for me, it was the importance of the reclaiming of our identity, and we can't do that unless we see ourselves represented, and that's not only in media but all spaces. Mm-hmm. And then one way that we can build upon that is through storytelling and celebrating our identity, but also highlighting the inequities.
Shahela, can you share with us some of the issues that you've seen not covered in this news desert that struck you as an Indigenous woman and as a news consumer?
Yeah, definitely. I think that there's a lot of issues that are not covered, and I think one of the things is that we're often misrepresented in the media. So. There's just various stories, things like MMIW, missing and murdered Indigenous women, but I think also as well as just really the stories within community, they're just not being told. So the focus of Indigenous is to give a platform for those stories to be told from within community. These stories are coming from community members. These are stories that community members want told. There's no agenda from us on the team. We literally are coming in here as reporters, asking community members, what are the stories that you want told about yourself? And those are the stories that we are sharing.
Athena, I would ask you the same question. What are some of the things that you've observed in this area, in the Okanagan area, that struck you, as a journalist, as an Indigenous woman living there, as a consumer of news? Are there things that you saw how they were covered, or things that weren't covered that really struck you, and that you could share with us?
Probably for myself, because I do cover the education, so mine's more as news stories. I would be kind of around the Indian Act, around the status. There's so many misconceptions about just being a status Indian, so I wanted to just show people hey, there's other things going on. It's not just what people believe, right?
Mm-hmm. Kelsey, same question to you. What have you seen covered or not covered that struck you as an Indigenous woman, as a journalist, as a news consumer?
Yeah, just the lack of coverage of important issues that not only affect us and in our communities, but also affect people outside of our communities, and just that lack of good, educated, well-rounded journalism, which is something you don't see. It's always pretty one-sided. And we do have a lot of things here that need to be covered, and so the work that we're doing now, as Shahela said, is coming right from community.
I love it. I'm very curious to know what the vision is for Indigenous, but also if you could share each of you share with us a little sneak peek for our audience on what you're working on right now. We can start with Shahela. We can start with you.
So right now I'm currently obviously here in BC. The government announced reopening, so I'm working on a few different pieces that are featuring local Indigenous businesses and their plans for kind of reopening and what that looks like. Obviously longer term, we have quite a few different stories that we are talking about, and also from feedback from within community that we're still going over. So stay tuned for those stories. Don't want to give too much away, but just know that it is community-based stories.
Well, and I love to hear this because it's, APTN is in partnership with this too. So all the work that you guys are doing, we get to benefit from too. We can have you back on the show to talk about the projects that you do. Athena, give us a little sneak peek. What's occupying your time right now?
So right now I'm working on a story with School District 23 and 73. There were 500 students building a traditional cottonwood dugout canoe. And since COVID hit, they weren't able to, so the teachers are actually finishing it off.
I love that. Kelsey, what's keeping you busy these days?
Right now I'm working on a story, I think it's about to be published shortly, about the data governance and data sovereignty, and what that lack of important data is doing to our communities.
And of course, lots of you ladies will be filling your days just reaching out and getting word out there that Indigenous is now in this area, what it's all about, who it can help, how to contact you, all that networking that's super important when you get going in an area covering news. We had heard too that soon this will expand to Vancouver Island, which is also another news desert for Indigenous news. Do any of you know when that's starting, or how far are we off on that, or any of you looking to go to Vancouver Island, or will you be staying put?
I'm going to be based probably in the Okanagan. I think we just posted the job offering, so I wouldn't say very soon, maybe in the next coming months.
Amazing. Well, let's give everybody a little bit of background too on each of you, how you got into journalism, what made you want to be storytellers. Shahela, how did you end up knowing that this was your calling?
So the last 6 years I've been working primarily as a documentary filmmaker, producer. So I was just finishing up actually my first documentary with APTN that will be broadcasted later this year. And I was kind of looking at
what's it called, so people can keep an eye out for it.
Oh yeah, for sure. It's called Living a Legacy. So I'm just waiting back on the broadcast dates, and then that will be on APTN. So when I was in the process of finishing that project, I was asking myself what direction I wanted to take, and I really wanted to focus on telling stories from within community, and that was even before I knew about the job posting. So as soon as I heard from the Discourse and APTN's the Discourse's job position in partnership with APTN, it just immediately felt like the right fit, because that's the direction that I was wanting to go into, more community-based journalism.
Well, you're where you're supposed to be. I like that. Athena, give us a little bit of history on your background as a storyteller. Where have you worked? What drew you to the work?
So prior to this, I still currently work. So I work for Global News, Global Okanagan, as the Indigenous correspondent. So I started that this past year, and I just got really into being on a TV personality. And then Lindsay contacted me and asked me if I wanted to apply for Indigenous. So I said for sure. So I sent in my application and all my work, and it kind of just started happening. So I was super excited, because this has definitely been one of my dreams.
Amazing. Kelsey, what drew you to being a journalist, and what were you doing before you got to Indigenous?
So I've always been a photographer for the past 15 years, and doing a lot of more photojournalism. So the whole writing realm is a bit newer to me, because normally I do creative writing with Team Bannock and blog posts. So it's a bit different, but exciting nonetheless. And before this, I was working for the BC First Nations Gaming Revenue Sharing Partnership. And so through that, I got to meet with all the Indigenous leaders throughout BC, and created a really good rapport with a lot of communities. And so I'm so excited to share the stories of all the work that's happening right now.
And what do you see what APTN's role in this? What will that be? Will we get to see the stories? Will we be interviewing you? Have you had any conversations like that with the powers that be at Discourse?
Oh, I'm sorry. Who was that?
Oh, Kelsey, you can. Yeah, Kelsey.
Okay. So APTN is an advisory for us. So they've been offering us a lot of support around our writing style, things like that as well. But they are in partnership with the Discourse. So we do get to have regular contact.
Well, I, for one, I'm very happy to see and meet you ladies all here online, and excited to see the work that you guys are doing. Nice to know that the ball is rolling. You're making those contacts out there, getting the Indigenous name out there. People know who you are. Go to these, I want to say to our audience here at InFocus, these are the women you want to take your stories to. If you live in the Lower Mainland, if you're in the Okanagan area, hit these girls up. We know you have stories to tell because nobody's been telling them all this time. So these are the ones that you will want to get in your Rolodex quickly. Hit them up. I want to thank all of you for joining us today. I know you guys are busy just getting off the ground there. Thanks so much for sharing this with our folks. That is all the time that we have for InFocus today, unfortunately. Thanks to all of our guests, even ones earlier in the show, for sharing with us. Next week, we will tell you about a tragic bit of history: Inuit tuberculosis patients who were forced to carve to help pay their medical bills, and somber letters written to their families that never made it home. This is an APTN Investigates investigation you won't want to miss. That's next week. I'm Melissa Ridgen. Have a great afternoon.